Often we hear our elders say, what all diseases we get to hear of today. Never heard of them in our times. Back then it was so good, people were so healthy. Well, I would agree partly because I think back then there were not many resources available to diagnose. Leave aside treating those diseases. People also were not very aware or informed like today. Actually, I think I should say over-informed. Information today is just at the click of a button. So, not many diseases were heard of at the times of our parents. In today's world, be it diabetes or hypertension or thyroid disease, arthritis or cholesterol issues, people think it is okay to have them. They believe that it runs in the family, it's there in the genes, so they are bound to get them eventually in spite of their best efforts probably. What if I told you, no, you do not have to live with being tagged a diabetic, a hypertensive, arthritic all your life? How? Two ways. 1. Change your lifestyle. 2. Change your beliefs and your perspective of looking at the disease. Heart disease, stroke, diabetes, obesity, metabolic syndrome, which is basically a combination of having high blood pressure, cholesterol issues, and blood sugar levels which are a little above the normal but not really in the diabetic range. Then COPD. Basically, it is a disease of the lungs and few forms of cancers. All these are regarded as lifestyle-induced diseases. The way we live, the food we eat, when and how much, the air we breathe, the degree of physical activity we go about daily, the emotional state that we are in, the kind of people we surround ourselves with. What is your first thought of the day? What is your last thought of the day? How well do you sleep? All of this, in my opinion, is lifestyle. Many times when my patients get diagnosed with diabetes or blood pressure or cholesterol issues, most of the times the initial reaction is that of shock. This reminds me of a 37-year-old lady who had come to me with complaints of recurrent headache. On examination, her weight was 110 kgs. Her blood pressure at that time was 180 by 110. Her fasting blood sugar, which means the blood sugar in the morning without having breakfast, was 170, which is a little too high. Her lipid test, her cholesterol test was deranged. Now she was utterly shocked seeing her results, and I completely understood her state of mind. In one day, she was no longer the person who considered herself supposedly healthy because she did not take any regular tablets for any disease. But yes, she was a little on the heavier side because that runs in her family, because everybody in her family is on the chubbier side. In one day, she was now tagged a diabetic, hypertensive, and someone with hyperlipidemia, that is having cholesterol issues. Her question was, why did this happen to me? After evaluation, I concluded it was her lifestyle. So after diagnosis, I have seen mainly two of the things happen. One, patient totally rejects the idea of taking medicine. This again reminds me of this patient who had come to see me with complaints of chest pain and headache. On checking the blood pressure, he was found to have a systolic blood pressure of 230. Now, the blood pressure reading, when we talk about, there is an upper blood pressure reading that you can always see, and there's a lower one. The upper one is what is known as systolic, and the lower one is what is known as diastolic. So for this patient, I'm talking about the upper reading. Systolic blood pressure was 230. Then I came to know that the patient had been diagnosed to have blood pressure some time back, but never took the medicines which were prescribed by the doctors, because he had heard from people around him that once you start the BP medicines, you have to take it lifelong. Just a thought, how far could he have survived with a persistently high blood pressure? I had to remind him that he had to be living to make a decision on whether to take or not to take the medicines. In any situation, look at the pros and look at the cons. To take the tablet or not to take the tablet. Is starting a medication going to be in your favor for your present medical situation? Then take it. Otherwise, options can always be discussed with your treating doctor. The second type of patients are those who, after the initial shock of getting diagnosed with the lifestyle diseases like diabetes or metabolic syndrome or cholesterol issue, they include these tablets to be a part of their routine life. And there are many who become lax and start binge eating at occasions thinking, the tablets will take care, let me just thoroughly enjoy the biryani today. Now, I'm not at all suggesting you stop your medicines if you have been on them for a long time. If you have been prescribed, then it implies that the medicine is a better choice than not taking them for you at the point the diagnosis was made. Now, I'm not against medicines. I'm against the mentality that once Medicines have been started for the common lifestyle chronic diseases. That's it. They are here to stay. I'm against the mentality of you accepting that you have been tagged a diabetic, a hypertensive, or whatever, and you make it a part of your identity. So, am I suggesting it is possible to come off the tablets? Your diabetes can be reversed. You can get rid of the BP cholesterol medicines. Yes, yes, yes. In many cases, you can. There may be others where the dose of the medicines could be decreased. To be brought about to have optimal health, it's important to understand that be it cancer, arthritis, heart disease, or any other lifestyle chronic diseases, what is happening in them at the cellular level. Now, in simple medical language, if I were to explain to you what happens in cancer, I'll tell you that a cell in the body divides uncontrollably and that becomes cancer. And what about diabetes type 2? There is insufficient insulin in the body, either because the place from where the insulin is supplied, which is from the pancreas, is not working great, or there may be insulin resistance, meaning insulin is present in the body but there's an issue with utilizing it. Now, this is the simplest medical explanation, but this is what is happening at the organ level. What about at the microcellular level? What is causing all this? Just one thing: inflammation. In layman language, this is inflammation. Medically, when we say inflammation, there are 5 cardinal signs. 1. There will be redness in the area of inflammation, swelling in the area of inflammation, heat, the area is going to be warm to touch, pain, loss of function of the part which is affected by the inflammation. Once when I was speaking about inflammation, a medical student asked me, "Doctor, isn't inflammation good for us? Isn't it a part of the healing process of the body?" Well, he was right. Inflammation is a part of the healing process of the body, but the right kind of inflammation. It said too much of anything is bad. The same applies to inflammation as well. There are 2 types of inflammation. 1, acute, the inflammation which is short-lived. An example of this is the coronavirus disease. 2, chronic, meaning something which is present for long. Now, talking about acute inflammation, you remember this picture I showed you a few minutes back? The redness, the heat, the pain. This is our body's response when it gets injured, whether the damage is visible to the naked eye or not. The immune system releases the WBCs, the white blood cells, which in school our teachers always described as the soldiers of the body out there to protect the body from any harm. When one gets simple cold, it is this immunity which protects us and we recover spontaneously or with just symptomatic medicines. But sometimes when the inflammatory process goes on for long, the immune system keeps pumping the WBCs, then the chemical messengers, cytokines, everything enters the scene. The body thinks it's constantly under attack and it keeps fighting indefinitely. This is how autoimmune disease also have their underlying cause as inflammation. And when this keeps happening for a very long time, it becomes chronic inflammation. Research has now proved that this chronic inflammation is responsible for most of the commonly heard diseases of today. Be it cancer, type 2 diabetes, Alzheimer's, gut issues. How does one fight an enemy which cannot be seen? You cannot see, but you can feel it, yeah?